Oludare, thank you for staying with us. The word Japa has become an anthem for many Nigerians as they look to leave the country in search of greener pastures. According to a research study, 7 out of every 10 Nigerians will leave the country if given the opportunity to do so. One of the sectors largely affected by this wave is the health sector, as more workers have left due to inadequate salaries, lack of good equipment, amongst others. Recall that the House of Reps wanted to move the motion for health workers to work for 5 years before traveling. And recently, the federal government banned application for leave of absence for these workers. How viable are these moves to stop many from migrating? And more importantly, what can be done to ensure health workers are discouraged to migrate? These and more will form part of our discussion today. We're joining us via Zoom from Texas, USA, is the convener, Social Rehabilitation, Grace and Support Initiative, Dr. Oludare Marindoti. Good morning. Thank you for joining us.
Good morning, Veronica. Thanks for having me.
You're welcome. Now, let's even begin from how did we get here in the first place? I know that you have seen both sides. You've been in Nigeria before you moved to the US, and you understand both systems. Talk to us what perhaps we didn't do right to get to this point.
Thanks for the question. You know, if we want to talk about the origin of Japa, I think it might be difficult to just say that plainly in the Nigerian context because, you know, Nigeria is not the only country that encourages medical professionals to, you know, developed countries, places like, you know, India, Pakistan, probably even lose more patients, more doctors and healthcare.
But our attention is on Nigeria, though.
Yes. So I'm trying to get to the complicated aspect of it, you know. So we have the pull factor, which is what takes everybody there. We have a better economy over there, and definitely, you know, that will take us over there. But in the Nigerian context, Japa has also been a problem that, you know, has occurred ever since. Like, we have to be frank about it, you know. If you go on Wikipedia and look at the, you know, story of the current Minister of Health and the current Minister of State of Health, both of them did Japa immediately after leaving, you know, university. So it is something that has always been. But currently, the reason why we have a problem in Nigeria in the, you know, exodus of healthcare professionals was definitely a decision that was made around 2008 when I was in part 3, when, you know, our lecturers told us that we were half-baked doctors, and then because of that, they were going to reduce the number of people they were admitting so that they can focus more on us. And my question to my friends at the time was, if the cake is half-baked, do you blame the cake or do you blame the baker or the oven? You know, so it is that reduction in the admission that over about 15 years now, that has resulted into, you know, this acute shortage that we have, whereby we have hospitals closing down wards and all of that, you know. So that is one thing. But one of the things that has aggravated also definitely Japa is the economy. Is simple. It is very simple. Anybody, you know, listen to us back home can help me ask, you know, the Minister of State or Minister of Health why they jackpot when they did. It was because of the economy. It was better there. However, guess what? The economy has even worsened between, you know, when I left medical school and today. I saw my former teacher, who is now the CMD of my alma mater, OUTHC, on TVC, like about last month. You know, when I was leaving medical school, if you check out the worth of what I was earning when I was leaving medical school, is probably more than what he is earning right now as the chief medical director, just because of the, you know, devaluation of Naira and all of that. So definitely everybody, you know, every man wants, you know, a pursuit of happiness and, you know, good life. So I will not, I'm not going to, I'm a very patriotic Nigerian. My friends were shocked when I was going to leave, but I am not going to tell you that if your brother or if my brother was in medical school, that he should stay in Nigeria, because I mean, if you look at the working conditions too, which definitely from the remuneration right now, which I've mentioned about, and also the work condition, and also even medical bullying. There are so many push factors that I think make people who, you know, want to stay back in Nigeria leave. And those push factors are the things that I feel like the federal government can work on. I'm happy that they have started, you know, the whole process of recruiting more, doctors, and allowing more doctors, to come into the training pipeline. That is a very good thing, definitely. But they need to work on the push factor, which is essentially the funding for healthcare, and also the remuneration of doctors, and also the working conditions. I can tell you so many stories of my own experience. You look at a beard in my face right now. This beard was a symbol of my defiance when I was in medical school, when one of my senior colleagues just told me to go cut my beards for nothing. And then I had to tell him that, I had proselytized. I am now a Muslim. And unfortunately for me, that happened to be during Ramadan. So I could not eat for like a month because I was trying to resist, oppression. So these are some of the things that are very germane in worsening the old Japa syndrome. Also, the security situation of Nigeria. Doctors and healthcare workers are prime targets for kidnappers. And I'll tell you something that even happened in the heart of Lagos, around Bagada. A friend of mine, a nurse, went to withdraw money in the Zenith Bank around their axis. She saw something suspicious as she was trying to run away. They kidnapped her, put her in the heart of Lagos around 7 a.m. in the morning, not at night, while she was going to work, in a bus, drove her around for like 2 hours. They used a POS to, test our ATM card pin and transferred money from it into a private into another account. And there was nothing they could do about it. The bank said nothing they could do. The police said nothing they could do. So guess where my friend right now is? She is definitely in the United Kingdom, where she can be safe and make more money, and nobody will kidnap her or almost try to end her life. So these are so many things that have aggravated and worsened the conditions of health workers, because everybody assumes doctors have money, nurses have money. So if we don't fix those basic germane things, and we are trying to ban leave of absence, or ban doctors for 5 years before they get their practice license, we are not going to get anywhere.
Yeah, talking about the federal government, banning the issuance of leave of absence to health professionals. So you said that the federal government is already trying to do some things to cushion the impacts of Japa on the health system. But some other doctors said that this is not really what is supposed to be done, because those who wanted to Japa would definitely abscond. Rather, those who want to come back, who are planning to return, will definitely explore the leave of absence, strategy. But what's your position on this? Try to expatiate more on that.
Yeah, thanks very much. When you think about it, the people in charge, the Minister of Health, Minister of State, they are both doctors, and they understand that before you make a prescription, you should investigate, and from your data, you should use that in informing your decision. So if they have the data that maybe shows that it is the leave of absence that is propelling, it is the avenue, the access to leave of absence that is propelling medical healthcare professionals from leaving the country, then they should let us know that data, so that we will say, oh yes, what you have said is backed by information. Otherwise, everything is core premises. Because if you don't show that, it doesn't follow. Most people that want to leave just go. A lot of my friends, one of my friends called me when I just got here, and at the time, the only thing I was doing to make money was essentially, doing kabu kabu. And he called me, said, I'm about to go write my exam. What do you think I should do? I told him, man,
by kabu kabu, you meant taxi driver, because of our non-speaking audience.
Yes, I was the taxi driver.
Oh, is it actually called kabu kabu outside there as well?
I am using local content to describe it. I was definitely driving Uber and doing a lot of deliveries and other hard jobs, doing physical labor just to work and earn a living. And at this time, my friend asked me, what should he do? I told him, my life as a Uber driver is a whole lot better than my life as a doctor was in Nigeria. I was sending money as an Uber driver to my colleagues back home, who probably were the only ones working. I have children and wife doesn't have a job and everything, just to help them, balance their budget. So why do you expect me to tell, my friends to go? Leave of absence is what people who want to come back take. And I'll tell you the story of Dr. Awowale, who is a medical doctor with honors, with distinction, extremely good guy, went to the UK to learn, and is UTHC. He was my senior. He went to the UK to learn about special fetal health techniques, surgical techniques. He was offered a job in the UK. He chose to come back and he posted it on his LinkedIn that Nigerian mothers are worth it. I'm pretty sure when he left Nigeria for the UK, he took a leave of absence. What the federal government is saying is that that kind of a very good guy, very smart, the most intelligent doctor I ever saw in my life, they are going to deprive that man of an avenue to improve himself or come back home. If you look at a lot of the problems of the Nigerian, health sector, and I've said this on this show a couple of times, the Nigerian government needs to get out of the business of owning hospital and get more into the business of funding hospital and giving them regulatory direction to follow. It does not make any sense. The Minister of State, or I think he was also my teacher, the former CFD, was describing the process of just getting doctors employed. You have to get a needs assessment, then send it to the Ministry of Health, and then the permanent secretary sees it, and then they call the head of service, and then they call Minister of Finance, Minister of Labor, and everything before you can employ somebody. Maybe a doctor had an accident, is incapacitated, or someone died, or something, someone traveled. And then while you are doing all that bureaucratic process, Nigerians are dying. It doesn't make sense, and I've always had this opinion. And the former Minister of Aviation, I saw an interview from him like about a few weeks ago, where he gave an historical context to this. The Nigerian hospitals, OETHC, UCH, UNN, ABU, they were all created by the regions. Then after the Civil War, the federal government united everything and brought them out. The federal government was not in existence back then, at least as the way it is right now. And they now created what I call a federal bottleneck that has hampered the decisions and the smooth running of these hospitals. When I was in working in FMCO, if you wanted to have a surgery, let's say for example prostate removal or something, you will wait like 18 months to do it in a federal government hospital. But that same doctor that works in the federal government hospital will take you to somewhere else and do it the next day. So now, when you look at it, it's not his fault. It's not like he was trying to steal patients from the government, but there was just no space. And they cannot expand the space based on their own demand, on their own need, because the federal government is at arbitrage on their neck. The federal government's role is detrimental, extremely detrimental to the healthcare delivery in the country. It is not a matter of what administration or not. A part of the restructuring should give the healthcare facilities back to the management board of each healthcare facilities. And the federal government should focus on funding all healthcare facilities, including private and public. Yes, the NHIS needs to get better, economy needs to get better so that people can contribute into it. Right. But the federal government cannot focus on funding just a few hospitals and expect healthcare in Nigeria to get better.
Right. Perhaps this is why there are those who are calling, especially the House of Representatives, calling for the exploration of public-private partnership to bridge the gap in the healthcare system. I wonder what you make of that.
Yes, public-private partnership is the way to go. And I also tell you a very privileged story. When I was the house officer at FMCO, that was during the Governor Mimiko's regime in Nigeria, where they had mother and child, right? Back then, mother and child was lauded as this very lovely situation. And I could remember, because my father is the private practice, they tried to meet the Ministry of Health at the time and tried to let them say, involve us, the private practices, private practitioners. We have our own patient population. We have a lot of them, so that we will have an agreement, subsidized definitely, and we will do all the CS and everything, and we will work together. And they were declined. Guess what? When I was in FMCO, about 90% of our maternal mortality when we are doing our mobility rounds came from that same mother and child. I had a personal experience of a patient that came in bleeding, and because of the effect of this program, a lot of hospitals could not afford to have a blood bank, and because they were weakened, they were not getting people to use it. So we didn't have a blood bank. So I was like, well, mother and child always talked about them having a blood. So around 11:30 p.m., I personally referred this patient to mother and child. And then the next few days or something, we had on the radio, oh, mother and child saved the life of somebody. They gave them 5 pints of blood, blah, blah, blah. And, they were definitely about to do hysterectomy, remove that woman's womb and all, because she was pregnant. And when I spoke to my father a few hours later, he told me that was the same patient that I referred from our hospital to mother and child. The reason why they have to give her satisfying price of clothes and all because she got there like 11:30 p.m. and nobody attended to her until about 1 p.m. the next day because the private-public partnership was not being explored. Because it's a very sad thing when politicians see healthcare that's supposed to be about taking care of people as a political, cudgel or avenue to win the next election. It does not solve the problem. Public-private partnership is the way to go. The federal government needs to allow the public hospital. That is why every Nigerian knows when you go to a government hospital, you are bound to have a terrible experience. 95% of the time, unless you are probably the son of somebody or an influential person, the experience will be terrible. And that is because this is not being run by the board of these hospitals. It is a bureaucracy. So nobody cares. It is a government job and it is Ogata or Gauta. That is to say, if I make a profit or not, my salary will come to me. But if these hospitals are privately run, they will not be a for-profit business, but they will be a business that will be efficiently run. Then they run, and then they can sign, a do not compete agreement with their specialists and their consultants. Right. Don't take our patients away and go and treat them in a private setting. And these things will run more smoothly. Decisions will be made immediately when they are needed. If the CMD, my teacher that was there, the CMD of OETC, is a man of impeccable, integrity. I don't even agree with him most of the time, but you will know that his heart is always in a good place. He can make decisions. He can do the right thing. And please, I would also want to advocate for the people who have not been paid in my alma mater, OETHC, that the government should please take up responsibility for the actions of the people that they put in charge of that hospital. Because they put them in charge of the hospital. So whatever they did, albeit illegal, they are still responsible for it. And these people gave a letter of employment to these 1,700 and something workers. So yes, they can say because it was an illegal employment, they want to terminate their employment, but they should pay them. That is responsibility. They are not guilty of the illegal act, but they are responsible for it. And as a part of taking responsibility, those people should be paid. We need to have a conscience and a heart. These are people's fathers and mothers.
Yeah, that's right. It's good that you are also doing Aluta from the UK where you are. But then I want you to also speak to the fact that, I saw a story just this morning of a guy who relocated abroad and then started sharing the stories, and then he asked people to congratulate him that he has relocated abroad, and people were congratulating him on Twitter, and some are even saying that we tap from your blessings. But at the same time, I also want you to speak to the fact that, the risk of Japa, it also comes with its own consequences. For instance, UK saying that, just the new policy of families who will go for, care workers and won't be able to bring in their own family, invariably asking them to come and take care of their own ages or their own family without, and then leaving their own family behind. And there is also a story on the front page of The Guardian, which is the big story, saying that how visa system deportation risk silence exploited care workers. And it says that, for instance, of a lady who's named Abeno, a migrant worker from Southern Africa, was repeatedly raped by her manager at a UK care home, but felt unable to report him to the police for fear of losing her job. Another person, Bernice, from Jamaica, was sexually exploited by a landlord and accommodation arranged by our employer, etc. So it gave the list of that. I'm not saying that they are among the dozens of migrant workers who have traveled to the UK to fill vacancies, only find themselves exploited and silenced. What do you make of that?
Yeah, definitely journey of migration is very difficult. That's why sometimes when I see people in government try to vilify and demonize people that migrate just to make the lives of themselves and their families back home better, I really wonder, like the Yoruba people say, oh ye wise and elderly, swear you've not been young and delinquent. It is very challenging. Definitely, the issue is so depressing and so sad to hear the issue of sexual exploitation. I believe, contrary to the fear that people might have, when you are exploited, that gives you an edge to stay in the country. And also, when you think about it, like the culture shock, you imagine someone who went. I want to consider myself a very intelligent guy. I'm pretty smart, and I have to come to a country, and I would live in a terrible apartment in not the nicest neighborhood, and I have to do kabu kabu and carry other people's load on my head and climb mountains and all of that. And I'll feel like, yo, man, in my father's house, there are many mansions, and I have to go up through all this. It's not an easy transition. But when you go through that transition, because you're coming in from an economically disadvantaged region, so you are definitely going to be in a low economic class, but your social class is never the same. So you are always going to climb that social ladder, that economic ladder that will match the social class that you are going to be in, whatever native country that you are in. So definitely the challenges of running away is difficult for you to know how much objection and how much frustration that has pushed people away to go to other countries. When my father was a medical doctor in the early 80s, 90s, he always laughed at his friends. He always laughed at them that one was even probably working as a nurse and something, and he was like, "Oh man, you are a old doctor, you went back home," because they were comfortable. The friends don't come back from abroad and then they will oppress them and all, because they could afford anything. At my age, my father had me, and he had multiple cars and all, and he was doing good. I graduated about 3 years prior to when my father graduated. If I had stayed back in Nigeria, I would not have been able to afford 10% of what he had in the 90s. So when you look at it, it is not easy, but it is still way better than staying back in Nigeria, where you can be kidnapped and police will harass you and your economy is going to nuts and all of that. So we need to have the sympathy. My father has the hospital, call him today, tell him you want me to come back home and take over from him, and see what he will tell you. Do you think my father sent me to medical school so I can go away and be working in another man's land? No, he wanted to leave a legacy for his son that the economy has, it prevented him from living. So when they are talking about, when the federal government starts focusing on just the people living in the government hospital, what about the people who never had the opportunity to even make it to the government hospital? I never went because I didn't want to deal with the oppression and all, but it is something that we have to look at holistically and with compassion.
Importantly. Now, quickly, the Coordinating Minister of Health and Social Welfare, Mohammed Ali Pati, revealed that Nigeria has lost approximately 15,000 to 16,000 doctors to brain drain in the past 5 years. And I'm wondering how long you think it would take for us to be able to cover up the gaps left by these persons.
Yeah, thank you very much. When you think about it, I was on this show, I think, criticizing the president's statement that, yes, don't let them, if you want them to go, let them go. We are going to train more. If you want to train more, it's a good thing, but if the president thinks about it, the people that he wants to start training today to be doctors will not be able to work until the end of his administration. That is after he wins the second term. So it is going to take a long time. It is not a sprint. It has to be a marathon. We have to, that's why I've always advocated for something like, a nurse practitioner, scheme, whether we take our nurses who are experienced. When I was a young medical doctor, nurses taught me a lot of things, delivery, basic dosing and all, some of those things. Those people can, plug the gaps, while we take our doctors and give them much more higher training and let them get fulfilled and prevent them from exploitation and bullying by their bosses. No doctor should have to fail an exam because he failed to go and pick up his oga's child from school, and which is part of what happens in our government hospitals. So when you look at it, it is a long story. We need an attitudinal change. We need the reorientation. We need to entice people. Soft power is often much more effective than trying to pass some draconian laws, which are just draconian in nature. So we need to, take the time, educate our people, make people's life better, secure the country, fix our economy, allow the youth. We have a very strong advantage in our youth population. Give them the jobs that will make them contribute into an health insurance scheme that will boost the funding for the healthcare sector. And then over time, you will see that a lot of Nigerian doctors will even start coming back home and using their special skill that they have acquired to boost the economy. We have a lot of people who were coming from, abroad, UK, everywhere, to do some procedures in Nigeria and go back home. We will tap into that brain drain, convert it to a brain gain. If you look at, I will always tell you, both Veronica and Ibrahim, both of you, I don't think you guys maybe grew up in Lagos. Maybe you did, but even if you did not, the reason why you are living in Lagos or Abuja right now is because your job is right there. So if we connected Nigerian doctors in diaspora with a good population, with a good market, with a good number of patients in Nigeria, and put their money, their livelihood back home, they will have no option but to come back. Nigeria, everybody loves Nigeria. We love the spirit, we love the vibe, we love the energy of Nigeria,
But
and we want to be back home.
there's something you raised that I'd like for you to expatiate on, talking about bullying of doctors in federal government hospitals. You need to expatiate on that because those are weighty allegations you mentioned, some of them failing exams because they did not go and pick up their boss's children from school. How is that?
Yes, it is so unprofessional and so distasteful and so shameful, and it goes unnoticed. You know, you talk about sexual exploitation. When I was in FFG award, there was one of our guys that had cases of two of my colleagues that we were working as house officers together, were both sexually molested, and nobody spoke about it. That is just one of. I mean, when I was in medical school, we have doctors that would tell their junior colleagues, your wife should stop sleeping with you, your children should stop calling you daddy just because they asked you a question. They will go through exams. Yeah, I mean, and this is one of the negligence when it comes to the federal government regulates all these things, because the federal government invests in the residency training. So if a resident is going to be failed, there should be a detailed explanation of why they failed. Not that one man just woke up on the wrong side of his bed, or maybe his wife denied him his advances at night, and then he's angry, goes out and fails the students. These things happen all the time where you see people that have spent, and I'll tell you this is for a fact, all my colleagues that we graduated together, that took them maybe like 4 or 5 years before they went abroad and were able to integrate with the system, finished residency, became a specialist in whatever they chose to, before the ones that got in directly into the Nigerian residency system. So why are we making residency so difficult? Why are people spending undue amount of time just trading to become a resident? These are things that we need to focus on and try to stop. These are the push factors that is making doctors leave when you don't want to deal with the BS of your bosses. When you come out here and you see the way people treat you with respect.
Dr. Oludare, I need to quickly ask a question. Is there a channel for doctors to lay their complaints, especially about this bullying and harassment that you have mentioned? Because these matters have to be investigated.
Yes, they need to be investigated, but there are no official channels. I mean, I knew one of my bosses when I was working in FMC that would talk to doctors in a disparaging way in the presence of the patient, that when the doctor goes back to see that patient, the patient will tell him, please don't touch me. This is a doctor in training. You are training him. That is why he is there. It's not for you to harass him and demean him and bully him. So there are no official avenue to report, because even if you report, you are reporting your boss, who is going to have to sign off on your paper before you can go to the next level. So you are not going to do it because it is not an open playing field. There are no avenues, and it's going to become very too complicated, because the only boss that most of them have is probably the federal government or the state governments, and there's a lot of bureaucracy in that regard. There are no avenues for doctors to fight for their rights, to fight for their human dignity and decency from their bosses. That is why it becomes a culture whereby even some that were opposed to it go through that system, and then when they get out, they start bullying the new generation. The medical bully is something that should not be condoned, and this is a significant push factor that makes doctors leave. It is nobody in any other profession. There's no other profession in this country that bullies the young ones like the medical profession. That is one of the reasons I never got into residency, because I knew I was not going to take it. I am a man. I would die where I stand. I am the son of my father. I will not let anybody bully me. That was why I didn't get into residency, because I knew. I mean, imagine someone telling me to cut my beards. It was not even this much then. You probably can barely see it.
Right.
How is my beard affecting my care of my patients? So these things are things that the ministry needs to regulate and let the hospitals manage their own affairs.
Interesting perspective that you have brought into this whole conversation over time, because I believe this is the first time we are hearing someone talk about doctors being bullied in this manner. And we believe and hope that the appropriate authorities will begin to look into these matters that you have raised. We must thank you. Dr. Oludare Marindoti from the U.S., the convener, Social Rehabilitation, Grace and Support Initiative. Thank you for your time.
Thanks for having me this morning.
Right. Still ahead.